All right, so this morning we're navigating the complex world of sarcoma cancer in Nigeria. Earlier on, I was having an engagement with my colleagues and I was trying to just speak with them. Have they heard about sarcoma cancer before? Yes, they must have heard about it once or twice, but it's a rare kind of cancer which is rarely talked about. And that's why we're focusing on that this morning, because the month of July has been designated as the Sarcoma Awareness Month. And joining me on the phone line this morning, Dr. Adewumi Alabi is consultant clinical and radiation oncologist with the NSIC-LUTH Cancer Center, and she's joining us on the phone line. Dr. Alabi, it's nice to have you. Good morning.
Good morning, Mr. Victor. A very good morning to all our listeners.
Wonderful. The last time we had a conversation on this was 25th of July, 2024. This is a year. This is a year later. So, how's it been in terms of the campaign for sarcoma cancers? Are people getting aware of it now?
Yes. So we keep making improvements every day. We keep getting better. We keep advocating, and I think this is one of the things that we're still doing as we're doing this morning. We can not get worse. We can only get better.
Right. So what is sarcoma cancer then?
So sarcomas are cancers that can occur in the bones and soft tissues. So when we say bones, I'm sure everybody is familiar with what bones are.
Mm-hmm.
And soft tissues are those things that surround the bones, like muscles, connective tissues, cartilages, the joint space, and so all those things. You can have cancers, even from the blood vessel that supplies the bone. You can have cancers arising from it. Cancers are things that we define as an abnormal growth. They don't grow in a normal fashion, and when they grow, they cause a lot of discomfort. They cause a lot of they can cause pain. They can come with some other things. But what makes them cancer, or what differentiates them from other swellings or tumors or lumps, is the fact that they have this ability to migrate from where they originally are and go to other places in the body.
Right. So we've heard of breast cancer, we've heard of prostate cancer, cervical cancer, skin cancer, but rarely do we hear of sarcomas. So what's making it unpopular?
Sarcomas are rare. They are not as common as all these other ones. But the honest truth is that they do occur. And usually when they occur, because they are rare, people are not aware. So you have a mother who comes in and says, oh, he's been complaining of pain in his leg for like 2 years. But they just felt that it was because he likes playing football, and now he fell down while playing football. Then they saw that the leg was swollen. So there's always a history of something going on.
Okay.
And so, but because we don't usually pay attention to it because we are not aware, and then it now becomes advanced by the time they will present. So it's a rare tumor. It's not common, honestly.
All right.
It's rare. It can affect any age group: children, adults, adolescents, young adults, elderly. It can affect any age group, but it does occur.
All right. So, Dr. Alabi, if we're 10 in a room, how many will come down with sarcoma cancer?
Oh, you may not even have any. You said 10.
Yes.
You may not have any.
Okay.
That rare.
Okay, so that's still good. It means we're not so bad with it yet. So, but what causes sarcoma cancer then?
We don't really know what causes cancer. We usually talk about predisposing factors. Okay, we say there are things that are associated with some particular cancers. So we can't really say this is what is causing the sarcomas. But what we do know is that it can run in families. Okay, it has family predisposition. It can also be associated with some chemicals, exposure to some certain chemicals, toxic chemicals, pesticides, and what have you. And the causes are usually unknown.
Very rare.
They are not as when you look at risk factors for breast cancer, for cervical cancers, that for sarcoma is not so many.
Okay. All right. So,
that's
what are the signs? What are the symptoms that would show that somebody is coming down with sarcoma?
So the symptoms, most oftentimes, swelling is a very common symptom with cancers generally, including sarcomas. It comes with pain. Most cancers do not have pain at the initial stage, but eventually it comes with pain, because by the time it is overstretching its boundary where it is located, it will have associated pain. It can come with forming a wound. It can come because when it enlarges more than the space where it is, or stretches on the skin, it can form ulceration or form a wound. It can bleed.
Okay.
Bleeding can occur. It can make the person lose weight. It can make the person feel sick. Depending on the type of sarcoma it is, because we have different types of sarcomas. Sarcomas, we have rhabdomal sarcoma, we have soft tissue sarcoma, we have leiomyosarcoma sarcoma, we have so many, osteosarcoma, airwing sarcoma, so there are a lot.
Okay.
So it depends on where it is coming from. If it's coming originally from the bone, it can destroy the bone such that a fracture will occur. And so the first person will present it, because the bone becomes weak, it can become a fracture, and then the person will come to the hospital and say, oh, I was walking and then I had a fracture, and then the person will say, oh, let's check, why did you have a fracture? By the time you investigate, then you see that it happened to be, it was a cancer that was there that made the bone weak. So it can come with so many symptoms.
Okay. I'm having a question that's coming here for you, which is just similar to what I just asked now. It says, good morning, Victor and Dr. Alabi. This is the first time I'm hearing about this sarcoma cancer. What exactly is it, and how is it different from other types of cancers? Deji Ajayi is sending that one in JG. Thank you. Anyway, even though I know you've talked about that, but maybe you can just still explain to Deji.
Yeah, so we say sarcomas are not common, they're very rare. That's why you haven't heard about it. But just like we're saying, that we keep advocating and keep talking about things that are important to our health, so that we can know how to take care of ourselves. So if you see an abnormal swelling on your body, you won't know whether it's cancerous or not. You won't know whether it is sarcoma or not. What is expected of you is to go to a good, I don't want to say just go to anywhere. Don't go to just any medical facility. Go to a facility whereby you can get good access to care.
Okay.
So, and sarcomas, like we have said, that sarcomas are cancers that can arise from bone or soft tissues around the bone. Soft tissues around the bone means muscles around the bone.
Okay.
Muscles are into three categories. We have smooth muscles, we have skeletal muscles, cardiac muscles. So we have so many muscles like that.
Right.
So muscles are into different categories, and so sarcomas can arise from any one of these.
Anyway,
so we can,
as long as the tissue around the bone.
As long as the tissue, even blood vessels
Wow.
around that area, you can have what we call angiosarcoma, you can have fibrosarcoma, liposarcoma. So there are so many, and they are named after the tissues where they arise from. All
right, this one says, good morning, Victor. Can sarcoma be passed on genetically like breast cancer? Ugo
yes, in
from Bariga.
In a few instances, yes, it can. I won't say passed on like that. So it's not that it is passed on, but the genetic makeup of individuals, it can run in families, such that, because this particular family, there's this genetic makeup in their genes, which can make them prone to cancer, such that maybe the father had cancer of the bone, and then the child also now has cancer of the bone. So it can run in families, but not all times do you have cancers of the bone or sarcomas running in families, but in a few instances it can run in families.
Cancers of the bones, is that not leukemia? What is it called?
Leukemia is so we were differentiating it now from the cells that are produced in the bone.
Okay.
Is different from the bone itself. So within the bone, you have what we call a marrow. If you eat chicken or you eat goat meat, there's that thing that people like to suck that is inside the bone.
Yeah, inside the bone. That's the marrow.
That's the marrow. Okay. So that's the marrow.
So cancers go there too.
The marrow produces red blood cells.
Right.
Produces white blood cells, produce other cells that are useful in the body, and so you can have cancer arising from those cells that are being produced. So they are more of hematological cancers. Right. Hematological means blood forming cell line cancers. So not necessarily that leukemia is a cancer of the bone, but because the cells that are being produced in leukemia are from the bone. So that's the...
All right. Another question here says, Dr. Alabi, can trauma or injuries to a body part trigger the growth of sarcoma later on? Mama Francis is sending that one in. Thank you so much.
Honestly, that's a very, very good question. We've looked over the years, because I told you that we don't know what causes cancer, but we try to look at some association and look at it and say, oh, could it be trauma that made this person have cancer? And so some things are not yet clear cut. Okay, so but it's not impossible that trauma can, but it's not clear cut. It's not one of those strong factors that you will say, oh, definitely trauma causes it, but it's not far from it, but it's not clear cut. And so we will not say yes, we will not say no, but I'm sure that over the years more research will be done to actually say if trauma is a strong predisposing factor to sarcoma. All
right, this person is reading my mind. I think it's B. Just the next question I want to ask you. It says, good morning, Victor. Please, it says, please, doctor, is surgery the only treatment option, or can it be cured with radiotherapy or drugs? B from Ogba. Thank you so much.
So sarcomas, just like every other cancer, has treatment. Surgery is an option. Chemotherapy is an option. Radiotherapy is an option. Even targeted therapy now, we're beginning to use them for sarcomas. Okay. So there are different treatment options for sarcomas. When we look at surgery, the importance of surgery is that you want to remove the real tumor. Okay, sometimes you may have to give chemotherapy to shrink the tumor so that the surgery becomes possible. So that is the role of chemotherapy now, and also to make sure that the cancer does not spread. And so, because one of the things that worries us with sarcomas is that even most times...
Hello, doctor? Dr. Alabi, are you there? Okay, all right. We're just about running that off, and she's just trying to let us in on some things that could be very, very worrying. Okay, doctor, you're back?
Yes.
So we lost.
So they won't even know.
We lost you for a bit there. You said one of the things that is worrying about sarcoma is what?
Okay, yeah. So it's the fact that when people present, about 70% of cases, when they come to the hospital to present and their diagnosis is made, it would have spread already.
Wow. Okay.
That's because of the late presentation one, and because it's not a cancer that you easily see. So things would have been going on in that bone or in that soft tissue, and you just saw it as a swelling, but you say, oh, it wasn't painful, but it wasn't painful, and it was not really increasing in size. It is usually when people are now uncomfortable, maybe it's restricting their movement, they're not able to walk, or they now have pain. That is when they will come to the hospital. And so by that time, most times it would have spread. Okay. And so that's where chemotherapy comes in. I was trying to explain when we use chemotherapy for sarcoma. So usually when you want to make the tumor smaller, or when you think the risk of it having spread is high, you want to give chemotherapy.
Let's run this off right now because of time constraints. Okay. So what's your message to our listeners as we round up the program?
Yeah, so my message is that early detection is still the best chance at cure. Sarcomas too are curable. We've had very good successes with some patients. We wish we can have more successes. So let's take care of ourselves, present early to the hospital, and God will help us. Thank you.
Dr. Adewumi Alabi, nice having you on the program. Thank you so much.
Thank you. Always my pleasure.
All right. She's a consultant clinical radiation oncologist with NSIC-LUTH Cancer Center. And of course, she's also a fellow of the West African College of Surgeons. All right, then we're going to take a short break right now. When we return, we'll talk about all things consumer protection and how LASCOPA is changing the narrative in Nigeria.